Good morning. My name is John Pointer, and I'm representing the California Senior Legislature. I wanted to welcome you to the 2023 Senior Rally Day. We have over 550 Californians who've registered for today's rally. We have an excellent program today, and we will be joined by a number of distinguished guests. Kevin Prendeville, Executive Director of Justice and Aging, will be our Master of Ceremonies. We are honored to have Kevin perform this role again in 2023. So let's get started. Kevin, let's start today's program.
Thank you, John, and welcome everybody to the 2023 Senior Rally Day. As John said, I'm Kevin Prendeville. I'm the Executive Director of Justice and Aging, and I'm thrilled to be with you all again today. As John said, we've got over 550 people registered for today's event. So thank you for being with us. We've got a really exciting program ahead. Today's program is designed to do a couple different things. First, we're going to get to hear from members of the legislature on issues that they're working on that impact older Californians. We're also going to hear from the California Department of Aging, who's going to provide an update on the Master Plan for Aging, as well as the current status of the 2023-2024 budget. You'll also get to hear from our premier sponsor, the California Collaborative on Long-Term Services and Supports. And then there's going to be a panel discussion on issues of equity and aging, ageism and ableism. But before we get started, I want to acknowledge all of our sponsors and exhibitors. Their support is crucial to the success of the program today. I would also like to acknowledge the legislators who choose to participate in the rally today. Many of them have been with us over the years, coming back year after year to engage with all of us, to talk to all of us about the issues that are impacting our communities. We really appreciate the support of each of the legislators who participate today. So without further ado, let's get started. I'd like to begin by introducing Assemblymember Dr. Yasmin Baines, who's the newly appointed chair of the Aging and Long-Term Care Committee. Assemblymember Baines represents the 35th Assembly District from Kern County. Prior to her election, Assemblymember Baines worked as a family doctor, providing primary health care to families throughout the Valley, and she chose to work in underserved healthcare settings to increase access to healthcare for her community. Assemblymember Baines, welcome to the 2023 Senior Rally.
Thank you so much for having me. A little correction. I still work as a family medicine doctor, not prior. I still do, as it's really important to have an ear to the front lines. Still run a rehab for people in recovery from addiction. So still very actively involved as a doctor. I promised my mom that I would definitely keep up my medical license and I would not step away from the medical world. So good morning, everyone. I am Dr. Baines. I am Assemblywoman for District 35 and the current chair for the Aging and Long-Term Care. I want to welcome everyone to your virtual Senior Rally Day. Working virtually, we all found ourselves presenting in a format that was unlike any other, and it took time for adjustment. Yet the greatest benefit is inclusivity. As the chair of Aging and Long-Term Care Committee, I remain committed to keeping phone lines available for hearings. Sacramento often forgets how open government isn't always open if you can't get to the Capitol. Thank you for having me today. I'm so pleased we are all able to connect. Many have asked me to address what I see impacting aging in the future. How will we all impact aging moving forward? Well, through collaboration. By recognizing each of us brings something important to the table. Every single one of us has an experience or voice that's very important and critical to key decision making. I am hopeful we will continue to work diligently for the benefit of others in the years ahead. We are about to hear the governor's May revision. In the next few days, we are going to undoubtedly hear cuts. This never fares well in the human service fields, but all of us are certain about what is ahead. As a population of older Californians boom, we will push an already decimated workforce at all levels of care delivery. We are not meeting capacity. That is the reality of the situation at hand. Nutrition needs are ever present. The pandemic highlighted how many seniors were food insecure, and inflation isn't helping. If you can't afford food, you're likely not paying for medications. And as a doctor, this concerns me greatly. I see it every day in my district on the front lines as an active family medicine doctor. I know my constituents are not having their needs met. I have served in third world countries and thoughtfully feel we as Californians in the fourth largest economy should honestly be ashamed that we do not do better for our older adults and people with disabilities. What I bring to Sacramento is a different lens. I proudly represent my hometown of Kern County, an area of California that has been unrepresented and underrepresented in Sacramento for a very long time. I'm the only practicing medical doctor. Actually, Dr. Weber still practices as an OB gynecologist, who is also my colleague in the legislature. And I am the first doctor to chair the Aging and Long-Term Care Committee. To repeat, I am still practicing. I was practicing physician before and during COVID. In reflection, I am still traumatized by the experience. There is a lot of things that happened in COVID that I'm still processing in my mind, specifically the lack of oxygen, the lack of resources. As physicians, we have seen a lot of people pass in a short amount of time, and I worry about the backlash and mental health of our healthcare workforce, as I myself have been dealing with the experiences that I experienced during COVID. I understand how important culture is to all of us and must remain a component of medical treatment and policymaking. Language is important. We all must be heard and understood. We must be mindful and intentional. We have to work together to be less in all spaces. And finally, if you aren't taking into account geography and policymaking, you aren't speaking to California. You are only speaking to Sacramento, Los Angeles, San Diego, and San Francisco. What inspires me on the screen today is that advocates like you continue to elevate the issues impacting the disability and aging worlds. You're geographically diverse, represent colors and languages, and are trying to bring back a better California to each of your areas. You are a great example of what it means to be collaborative and inclusive. Continue the good work. There is no going back to normal. So when I say there's no going back to normal, I say this with hope. We will go back to something better, a better space where those in disability and aging space have a more human experience, something that everyone wants to see and everyone deserves. So how can we all work to get to something better? We all got to work together. And aging and the LTSS world are best met when addressed together. How we can do this work in the years ahead is driven by all of you. I always want to hear issues that are important to you. Continue to work with Liz, our amazing director for the Aging and Long-Term Care Committee. So let's keep connected. I, like you, want to impact the aging and disability space. Let's do it together. Thank you for having me on this morning.
Thank you, Assembly Member. We truly appreciate your commitment to these issues and your leadership on the committee. Thanks so much for being with us. Great. Well, that was a great kickoff. So thanks again to the Assembly Member. Our next scheduled speaker for today was Senator Ana Caballero, who's the chair of the Government and Finance Committee. Unfortunately, Senator Caballero was called away to a Senate Budget Committee hearing today, so she's not going to be able to join us. But I do want to thank the senator for her leadership this legislative session on a number of important housing bills that would provide critical housing supports to older adults. Especially want to highlight SB 37, which is a bill that would create a targeted rental subsidy program to enable thousands of older adults and people with disabilities annually to keep access and keep their housing by giving them a modest rental subsidy so that they don't lose that housing and become homeless. So thank you, Senator Caballero. Sorry that you couldn't join us today. So I'm next going to introduce Assemblymember Mike Gibson. Senator Gibson, since 2014, has represented the 65th Assembly District. In 2015, Assembly Speaker Rendon appointed him to serve in the role of Assembly Democratic Caucus Chair. The Assembly member also serves on the following committees: the Governmental Organizations, Insurance, Business and Professions, Transportation and Rules. Assemblymember Gibson, welcome to the 2023 Senior Rally.
Hello, family. I'm Assemblymember Mike Gibson. I proudly represent the 65th State Assembly District. Those are areas that include Watts, Willowbrook, where I was born and raised, Compton, Carson, North Long Beach, Harbor Gateway, North and South, Harbor City, Wilmington, and San Pedro. I want to thank the California Senior Legislature for inviting me to participate in this year's Senior Rally Day. As you know, this year's theme is inclusivity. This theme is particularly important in the senior population, as many seniors are faced with social isolation, discrimination, barriers to access, healthcare, transportation, and other essential services. We need policies and programs that promote inclusivity and that support seniors' well-being and their independence. I have always supported the master plan for aging in its 5 bold goals, promoting housing, healthcare, equity, and access to services, opportunity for seniors across all communities. This year, I have 3 bills that are aimed at helping seniors in our community. AB 21, aimed to improve the ability of first responders and peace officers to engage with individuals suffering from dementia and Alzheimer's by providing them with the tools and training needed to effectively interact with those living with dementia. Assembly Bill 632, which eliminate the cost sharing for life-saving prostate examination. And finally, Assembly Bill 1606 seeks to authorize the Department of Motor Vehicle, the DMV, to establish an alternative renewal option for driving license applicants 70 years or older so that they don't have to go to the DMV. I want to commend the California Senior Legislature's efforts to ensure that seniors of all races and gender and socioeconomic backgrounds are included in representation in programs and services across the state. Your voice matters. So I want to thank you all for being here and using your voice to elevate your goals and your advocacy for our communities. Thank you so very much, and God bless you.
Thank you, Assemblymember Gibson. We really appreciate you being with us today and for your leadership on aging issues and on issues of inclusion. Our next speaker that was scheduled for today was Senator Maria Alvarado Gil, the chair of the Human Services Committee. Unfortunately, the senator has taken ill today, so she's not going to be able to join us. But I would like to introduce Assemblymember Aguiar Curry, who since 2016 has represented the 4th Assembly District. The Assembly member also serves on a number of committees, including agriculture, emergency management, governmental organizations, as well as the health committee. She's also the chair of the local government committee. So Assemblymember Aguiar Curry, welcome to the 2023 Senior Rally.
Hello, happy Senior Rally Day. As an older adult myself, I am well aware of the special needs of the aging population, and I plan to continue to fight for senior rights and care. California has the largest population of older adults in the nation, and we are also home to the largest population of individuals living with Alzheimer's. A passion of mine is prioritizing Alzheimer's disease and addressing the need for memory care. Now, many of you may know I authored the Healthy Brain Initiative bill last year, that aim to build support for the increasing number of people currently living with Alzheimer's disease. Unfortunately, that bill died due to costs. So we're trying a different approach this year, and that is why I'm authoring AB 387, which will expand Alzheimer's disease and related disorders advisory committee to ensure that more stakeholders' voices are heard as the committee issues advice for addressing Alzheimer's across California. Another important issue for me is making sure our seniors get appropriate care in nursing homes. Right now, some care facilities misuse drugs to chemically sedate dementia patients. These drugs are meant for treating serious mental health issues and increase the risk of death for people with dementia. I am authoring AB 48 to make sure that nursing home residents and their families are informed about the risks of these drugs and get to make informed decisions about their care. These are only a few things I'm working on, but as you can see, the needs of the aging population are always on my mind. I want to thank you very much for once again allowing me to send my welcome message to all of you. And I look forward to seeing you soon and continuing our work together. Thank you.
Thank you, Assemblymember Aguiar Curry. Really pleased to have you with us today and for your continued leadership on aging issues. And thanks for highlighting the important bills that you're sponsoring this year. I am next pleased to introduce Senator Bill Dodd, who is the chair of the Governmental Organization Committee. Senator Dodd was elected in November of 2016 to represent California's 3rd Senate District. That district includes portions of Sacramento, Yolo, Napa, Sonoma, Solano, and Contra Costa counties. As I said, he's the chair of the Government and Organization Committee. He also serves on the Housing and Transportation as well as the Insurance Committees. Senator Bill Dodd has an important bill, SB 278, that he'll likely talk about, that clarifies existing elder financial exploitation laws to ensure that all older adult victims of financial scams entities accountable for assisting in their financial exploitation. So Senator Dodd, welcome to the 2023 Senior Rally.
Hello, and thank you for allowing me to be part of the 2023 Senior Rally Day. For those of you who don't know me, I'm Senator Bill Dodd, and I represent the 3rd Senate District. It's my honor and privilege to speak to you all today. I want to first thank the California Senior Legislature for your tireless advocacy on behalf of California seniors across this state. Since starting in the Assembly in 2014, I've worked hard to prioritize issues impacting California seniors through legislation and advocacy in the budget process. It's a personal priority and a pleasure to advocate for the senior community. This year, I'm authoring a bill specifically aimed at protecting vulnerable seniors from financial abuse. That's SB 278. The breadth of predatory practices out there is staggering. Scams targeting seniors have proliferated across the country, with losses estimated to be nearly $3 billion a year. Given the pervasive nature of this problem, many people here today likely know someone in their lives or community that has fallen victim to financial abuse. And once a senior falls prey to financial fraud, oftentimes they may never recover. It's unfathomable to me, and I'm sure to all of you, the amount of lives that have been destroyed due to the actions of scammers and those who assist in their fraudulent behavior. Our older population are often targets for fraud and predatory practices due to their income, accumulated lifelong savings, and unfamiliarity with technology. It's devastating to think that the years of hard-earned savings can be gone within moments with little or no recourse. Currently, California's financial abuse statute is not as clear as it should be. As a result, this has created a near impossible standard of proof required to hold back bad actors accountable. My bill will hold those who assisted the fraudulent behavior towards seniors accountable by clarifying the elder financial abuse law. This means a person or entity who knows or should have known that an elder or dependent adult is subject to financial abuse, but falls, prey to this act, may be held accountable for assisting in abusive activity. Lastly, I'd like to highlight that I will again introduce a resolution recognizing Elder and Dependent Adult Abuse Awareness Month in June. As we all know, elder abuse continues to be a serious and growing crisis in California, and it's important that we continue to have those difficult conversations and bring attention to this important issue. I want to take a moment to express my appreciation to all the people that took time out of their lives today to make sure that seniors have their voices heard in the legislature and that we work together to achieve our shared goals. While there is much work to be done, with the committed advocates like all of you here today, I know we can assure that seniors thrive and will continue to thrive for years to come. Thank you again for allowing me to join you today, and I look forward to our continued partnership.
Thank you, Senator Dodd, for always being there for the aging community and for your presentation today and your leadership during this legislative session. We appreciate it. I'm next really pleased to introduce and welcome Dr. Joaquin Arambula. Dr. Arambula was elected in 2016 to represent the 31st Assembly District in Fresno County in the Central Valley. He's the first Latino physician elected to the California State Assembly. He's also the chair of the Assembly Budget Subcommittee number 1 on Health and Human Services. During his tenure in the Assembly on the Budget Subcommittee, he's done an incredible job focusing on improving healthcare for all people, especially the most vulnerable. He also serves on both the Health and Human Services committees. At Justice and Aging, we've really appreciated Dr. Arambula's leadership on so many issues that are important to the healthcare of our communities. So welcome, Dr. Arambula, to the 2023 Senior Rally.
Thank you for having me, and I'll take a moment and just appreciate the theme of today's rally, which is inclusivity. Understanding the importance that cultural and linguistic access to care plays for so many of our communities who have suffered disparities allows us to create more spaces. And I'm appreciative that with intentionality, you are focusing on inclusivity as it will allow us to create better programs. I want to just take a moment and acknowledge that by 2030, we are expecting 1 in 5 Californians to be over the age of 65. We are making significant progress on the Master Plan on Aging, and am impressed with the administration's commitment to addressing the issues that are so important for our senior community. I particularly want to uplift the expansion for our seniors and elders over the age of 50, as we have enrolled over 300,000 of our undocumented Californians into Medi-Cal that allows them to seek preventative care that they so desperately need. It is an appropriate response and continues the legacy that California has in leading to ensure that we are providing healthcare access for our most vulnerable. We know that healthcare is a human right and that we need to provide that access for all Californians, and have enjoyed the advocacy that we have done together, and know that it takes spaces like this where we are being intentional to be inclusive of all voices that allows us to make these changes. I will also speak about the budget item that we were able to pass last year that allows our elders and seniors who are having a share of cost on Medi-Cal to be able to address that with a budget item that should go into effect on January 1st. And so I look forward to ways in which we can continue to partner and work together to uplift the voices of our communities and to ensure that we are providing resources to those who need it. I'm grateful for the opportunity to join you here today at the Senior Legislature Rally Day, and wish you a wonderful day at your rally. Thanks for having me.
Thanks so much, Doctor, for your presentation and for your partnership and leadership on these issues. It's really been incredible what you've been able to accomplish in your time, especially, as you noted, expanding healthcare to so many populations of older adults and others that we're desperately needing and seeking that care. So thank you so much for that. So I am next pleased to introduce another tremendous partner and leader on aging in our state, Susan Damaris, who's the director of the California Department of Aging. Susan was appointed by Governor Newsom to serve in that role effective November 1st, 2021. Prior to joining the Department of Aging, Director Damaris led public policy and advocacy for the National Alzheimer's Association in California. Susan has been a tremendous leader and partner in so many ways and in so many roles throughout her career, and most impactfully right now as the director of the Department of Aging. So Director Damaris, welcome to the 2023 Senior Rally Day.
Thank you so much, Kevin, and good morning to everyone. More than 500 gathered here. This is fantastic. And thank you especially to our Assembly and Senate leaders and partners in this work for joining us this morning. It was great to listen in. I believe I have some slides to share here, and while they're perfect, while they're being pulled up, I especially want to thank our hosts for today. This is such a wonderful tradition, the Senior Rally Day, and I'm glad to be part of it. So we'll go ahead and move to the next slide. I was asked to talk with all of you about the Master Plan for Aging and how we're building communities up and down the state where people of all ages can thrive. And go ahead to the next slide. I hope there's not a single person on this as part of this rally that does not yet know the 5 bold goals of our Master Plan for Aging. But today I'll focus on goal number 3, which is the theme of today's event: inclusion and equity, not isolation. But we're making progress on all 5 bold goals. This is not a plan that sits on a shelf. And what you see on your screen here to the left is our annual report to the legislature. Senator Hannah Beth Jackson passed legislation at the outset and required that the administration report to the legislature every January. We did that this year, and it's a great partnership we have with the state legislature to keep apprised of the work. We also are proud that in January of this year, we released the data tracker. So anyone, anywhere, anytime can find out where we are with all of the Master Plan for Aging initiatives. You can sort by goal area, strategy, keywords, and that's public and available to all of you. We're really proud to be transparent in that way as we build off prior years. Next slide. And then this year, we launched 95 new initiatives. You may recall that in the first 2 years of the master plan, there were 132 initiatives. And now, because this is not a report that sits on the shelf, every 2 years to coincide with the legislative session, we'll introduce new initiatives. And this year, our focus, all 95 are coded. It's either something we're delivering on, analyzing, or communicating. And we'll move to the next slide and talk about some of the key items that we're delivering on. In the workforce area, we have Cal Grows, which is an initiative led by the Department of Aging, where close to $90 million has been made available to about 80 different community-based organizations up and down the state to help with their direct care workforce. We also are proud to partner with the Department of Social Services for their IHSS Career Pathways program. You heard from Dr. Arambula about the Medi-Cal expansions that we're thrilled that the governor and legislature supported to expand coverage to individuals over age 50 and older who are undocumented, as well as the share of cost and asset limits. We are thrilled that just yesterday we were able to announce a process for letters of intent for the Bridge to Recovery initiative. This is a little over $55 million that will go to adult day health care or CBAS centers, adult daycare, and PACE sites around the state. It's a competitive grant program, so get the word out on that. And then we've also stood up with legislative support a process to examine visitation in skilled nursing and assisted living facilities during public health emergencies such as the pandemic, to make sure that people stay connected to their families and friends. Next slide. In terms of analysis, because the master plan is a 10-year blueprint for our state, it's not reasonable to expect that everything will be done at the same time. So we are carefully examining a few things over the next 2 years. We're proud to work with the Department of Healthcare Services on an HCBS, Home and Community-Based Services Gap Analysis, where we're looking at all of the Medi-Cal and non-Medi-Cal funded HCBS programs throughout the state to determine, as you heard from Assemblymember Baines at the outset, that geography should factor into our policy planning. So we're going to be looking at parts of our state that are not adequately served. We're also doing California 2030. This is a close examination of the 33 area agencies on aging up and down our state that cover all 58 counties, and really looking at how we can modernize that network for the next 50 years. They're celebrating 50 years next year, so we're really focused on modernization there. We're excited to embark on a caregiver equity roadmap, building off of what President Biden issued late last year, and to really look at how California's caregiver resource centers, our area agencies on aging, and our vital CBO partners are delivering caregiver supports, unpaid, informal family caregiver supports, and how we can do more and do better. And then last, I know this group cares a lot about long-term services and support financing. How can we support people who are not yet eligible for Medi-Cal and ensure that they have access to home and community-based supports in the home and in the community? Next slide. And then to communicate, thank you to all. Dr. Romula was part of our work. We just concluded 4 older adult behavioral health roundtables. We met in Fresno, Ukiah, San Bernardino, and San Francisco over the last 6 weeks to really elevate and amplify the issues, concerns, and needs of older adults as it relates to behavioral health. And we heard from our community, and we'll be putting out a report in the next couple of weeks to summarize those findings. Suffice to say, older adults need supports, and they need supports close to home. So whether that's trusted community-based partners, the faith community, ethnic and racial and cultural groups that are trusted in the community, that really can be a bridge for older adults when it comes to mental health and behavioral health needs. We're pleased to work with Department of Healthcare Services and the Office of Medicare Innovation and Integration, OMI, at the Department of Healthcare Services to roll out CalAIM statewide. And we were thrilled to just have a webinar on Friday that many of you joined. Thank you for that. Focused on the PATH cited funding opportunity that's open through the end of this month. We encourage everyone who's eligible to apply for that funding. And then next week, we cannot wait to announce the grantees who will be funded for local master plan for aging work. We just concluded a competitive RFA process, and we'll be getting the word out next week to those that were funded. And then last but not least, and why we're here today and why this is such a great tradition every May, is it is Older Californians Month and Older Americans Month. And I want to thank our governor, who's such a fantastic leader on aging, disability, and family caregiving. Under his leadership, we established the Master Plan for Aging by executive order. And just yesterday, first day of the month, he got his announcement out that's part of this, the resources for the Senior Rally Day. So thank you to the governor for his proclamation honoring Older Californians Month. And thank you all for the work that you're doing all month long to elevate and celebrate older adults. And I think the next slide is the last slide. Our work continues. Next year, the Department of Aging will celebrate 50 years as a state unit on aging. And we're really turning our focus to what will the next 50 years look like? How can we be inclusive? How can we reach our charge from the federal government is to reach older adults with the greatest economic and social need. And so we'll be working with all of you to ensure that we meet that test and we provide equitable services and supports in all parts of our state. And last slide, there you go. Many of you were part of our Day of Action back in September. Thank you for joining. You may see yourself reflected on this picture here, where we heard from all of our stakeholder committees about the priorities for this year and next. So today, I hope you have just a fantastic day. Thank you for being part of the Senior Rally, and thank you for everything you do to communicate the important work that's happening up and down the state, and also the work that's not yet happening that we need to focus on in the future. Thank you all so much.
Thank you, Susan, for being with us today, but also your partnership and your leadership every day. We truly appreciate all the work and all the important items that you highlighted. I'm pleased to introduce next Nicole Shimosaka, who serves as the Deputy Director for the Division of Administrative Services at the California Department of Aging. She oversees audits, budgets, accounting, local finance, human resources, and business management at the Department of Aging. Deputy Director, welcome to the 2023 Senior Rally Day.
Hi, thank you so much for having me here today. I really appreciate the opportunity to connect with everyone. I am going to share with you all where we're at today and where we're headed as far as our budget is concerned. As many of you are probably aware, the Master Plan for Aging, along with the Home and Community-Based Services Spend Plan, have provided a lot of very exciting once-in-a-lifetime investments and opportunities that the department has worked very diligently and in collaboration with several others to stand up. We could start on the first slide, and here is our Home and Community-Based Services Spend Plan. This is the funding that CDA received in the amount of $365 million. Statewide, the Home and Community-Based Spend Plan was about $3 billion. And these funds were dispersed across California Health and Human Services departments. CDA was about 10% of that share. And we had a variety of various investments that we've been able to stand up. Everything from senior nutrition infrastructure grants, which are a once-in-a-lifetime investment in providing funding to the AAAs, area agencies on aging and their subcontractors to get new senior nutrition infrastructure such as cars, refrigerated vehicles, just anything they would have needed to be able to provide more meals and to keep up with the influx of funding that we saw during the pandemic. We received direct care workforce training and stipends, which is also known as CalGrows. And this is another once-in-a-lifetime investment to invest funding into our direct care workforce with training programs that you complete a training online and you would receive a stipend. And then once you use that new knowledge and skills within the field, you could receive another stipend. We also had the access to technology for seniors and persons with disabilities. This was funding that went directly to the counties in order to provide tablets, training, and Wi-Fi to older adults. And as you can see, there's a variety of other programs there. We've been very, very fortunate. We've been able to stand up all but one of those. The adult family homes for older adults was a pilot, but it did have an ongoing impact. And we found it to be precarious to go ahead and stand that program up without longevity there. So that is the only one that CDA was unfortunately not able to stand up, but all other investments are well underway. We could go to the next slide, please. In current year, 22-23, we received, I'm going to just highlight two really significant budget investments, one being the Modernizing Older Californians Act funding for a grand total of $186 million. Beginning this year, over the next 5 years, we're going to see $53 million that we can put towards supportive services programs. So that's everything from what is currently covered under our Title 3B supportive services programs, including new ones such as what is being referred to as aging in place. Oh gosh, I'm so sorry, I just drew a blank. But there's 40 different programs that are available underneath that one. And then you'll see in years 2, 3, 4, and 5 that we have $126 million in nutrition. Throughout the pandemic, we saw an increase in federal funding for nutrition, and we were very concerned about a looming cliff and what we would do to maintain the increased meal counts that we saw during the pandemic afterwards. Well, this is part of the answer here, is we're going to have increased funding for the next 4 years in order to offset that cliff and hopefully find long-term goals long-term solutions to the nutrition needs across the state. Next slide, please. My director, Susan Morris, touched on this a little bit, but Bridge to Recovery was another significant investment for us here at the department. $61 million that is intended for up to 1,200 facilities across the state. Any of them could apply. We're currently working on letters of intent right now to know who exactly throughout the state is interested in applying. And you can find that information on our CDA website, aging.ca.gov. And this funding is for the intent of preventing COVID-19 infections, preparing for any future public health emergencies, and to improve the workforce recruitment and retention in these facilities. Next one, thank you. And this is what is to come. This is what has been proposed for fiscal year 23-24. Phase 3 of our master plan for aging investments. And this one really focuses on the IT capabilities. As many of you are probably aware, we are working on creating a statewide call center. We're creating a statewide web portal to connect the various aging services. We're working on creating a learning management system, which would offer consistent training throughout the state for aging partners. There's a variety of things that we're working on in the IT realm. And so this BCP here, budget change proposal, will really help us to advance those efforts. We're also seeking a 1-year extension for the health insurance counseling and advocacy program modernization. This effort is well underway. We've been working with consultants to help advise us on how we might move forward with modernizing health insurance counseling and advocacy across the state. This program currently has a penetration rate of about 1% of all Medi-Cal beneficiaries. And the goal is really to increase that because, as you're also probably aware, this program does offer information for individuals to make the best decisions regarding their healthcare insurance, regarding prescription coverage. And it's not a program that would sell anything to you. It just empowers the older adults or their families so that they can make the best best decisions for themselves. We're also increasing funding for the CalFresh Healthy Living Program, also known as SNAP Ed. And this increase of $3.2 million will allow us to bring on 8 new counties into the program, which will provide everything from education regarding how to make healthier decisions and physical activity to how to go about, maximizing your dollar when you're grocery shopping. There's a variety of different things that CalFresh Healthy Living does to increase awareness around nutrition, healthy decisions, and then ensure that older adults are also getting enough, all the nutrition and food that they need. And then the next slide is just 2 more that were recently introduced. It's a statewide no wrong door feasibility assessment. And what this is going to do is it's going to create a leadership council across the state in order to inform how we go about the no wrong door implementation. No wrong door is simply a phrase used to define the idea that instead of having a person have to travel from department to department to resource, trying to find the right answers for themselves or a loved one, it's the idea that the person is in the middle of all of this and their resources come around them. So everything is interconnected. It would remove the bifurcated system that we have today. As you know, when many people need to go about finding their long-term services and supports in the community, it's usually a time of crisis. So having to go from place to place can be very hectic and it can be very nerve-wracking. The idea is here that we put the person at the center of it and we bring their resources around them. So this is just a 2-year pilot in order for us to do that research and foundational groundwork. The very last one is administrative efficiencies for area agencies on aging. And the idea behind this one is that we'd move away from our outdated contract system to one of direct allocations. It's it's really still a contracting process, but it removes a lot of the administrative hurdles that traditional contracting has. This would just be an ongoing memorandum of understanding. And as new funds roll in, we would be able to just build those into the existing memorandum of understanding and move those funds out much quicker. It would eliminate the need for a lot of the bureaucratic tape work, if you will. It would remove a lot of that so that we can move faster. And there's also language in here that would allow us to increase the maximum allowable amount for advance payments to AAAs up to 1/4 of the total allocation. This is just something that we've heard across the network that is really needed, especially for some of our smaller partners or nonprofit partners. So this is a BCP that is in response to a lot of the modernization that has been asked of CDA. Thank you.
Thank you so much, Nicole. We really appreciate you being here today and for your excellent presentation about so many of the exciting things happening in the CDA budget. So thank you for that. I'm next thrilled to introduce Maria Kalina. She is the Executive Director of the California Collaborative for Long-Term Services and Supports. She was named into that role in January 2022 after serving for a long time as a consultant to the collaborative. She's previously served as the Senior Project Director for a Sacramento-based nonprofit dedicated to bipartisanship and unbiased policy education. Finally, Maria served as the founding principal for Kalina Institute. Maria, welcome to the 2023 Senior Rally Day.
California is home to nearly 6 million older adults, the largest share of seniors in the nation. As the last of the baby boom generation enters their golden years, our population of individuals 60 and over is set to diversify and double, far outpacing growth in children or working age adults. This extraordinary demographic shift has long raised questions about the readiness of California and its system of supports for individuals with functional limitations, including nearly 7 million adults with disability. But California is answering the call. In 2019, Governor Newsom called for the development of a master plan for aging to better prepare California to address the safety, security, and quality of life for our growing number of older and disabled adults. California began to convene a broad cross-section of stakeholders to develop recommendations for a multi-sector statewide systems transformation plan, a once-in-a-lifetime plan that would address long-standing systemic challenges at the state level and provide a framework for local planning and development. The master plan set 5 bold goals and 23 strategies aimed at building a California for all ages and abilities by 2030. And with continued leadership of the Newsom administration and support from the legislature, which ensured a successful launch of the MPA through policy reforms and historic budget investments in 2021 and 22, in just a little more than 2 years, the vision of the master plan for aging is taking shape in California and paving the way for other states. Over 200 state-level initiatives are currently in progress, actively monitored by the Impact Stakeholder Committee, the MPA tracking tool, and the data dashboard. 29 counties are actively engaged in local planning, and 3 counties have an MPA and are actively working towards implementation. As one of 5 states with a master plan for aging, California is serving as a national model. 10 additional states are working towards the development of their own master plans, led by the Center for Healthcare Strategies. And more recently, CHCS has announced launch of a second cohort. California is making tremendous strides. It's true. However, there's still a long way to go, and we must keep up momentum to realize that our shared vision of California for all ages and abilities. As we emerge from the pandemic and look towards 2024, just 6 years shy of our 2030 target, the state continues to face substantial challenges with affordable and accessible housing and homelessness, crisis-level workforce shortages, a fragmented and underfunded system of supports, including transportation, that isn't keeping pace with demand, climate change, emergency response, and more. California is the largest economy in the United States, poised to be the 4th largest economy in the world, and yet Older adult poverty outpaces state average. Adults with disabilities fare even worse. With rising costs, many older and disabled adults are left with little to no options. Older adults are struggling to pay rent, with 35% of rented households with residents 65 or older spending more than half of their income on shelter. Many are falling through the cracks, with nearly half of the state's unhoused adults age 50 and older. And while demand for services is growing alongside the demographic boom, affordable options for care are not. A common misconception is that Medicare will cover care expenditures when the time comes. It won't. And if you're an older or disabled adult with an income in excess of $20,120 per year, you're left with very limited options. 89% of California's middle-income older and disabled adults would not be able to afford private assisted living without selling their homes. And as we see the number of older and disabled adults rise, we're seeing an increase in demand for caregiving professionals. But unfortunately, the supply is just not there. Taking care of others is physically and emotionally demanding, and our direct care workforce, largely women of color and immigrants, are not valued in the way that they should be. With historically low wages that can't support California's cost of living, 47% have to rely on public assistance benefits to get by, and others can't access benefits due to immigration status. While we're tremendously proud of the recent investments in this space, like the launch of the first of its kind IHSS Career Pathways program, which provides online and in-person training and career opportunities to the 550,000 IHSS providers, I think the major hurdles are still ahead. We can't have a comprehensive system of care without the caregivers. And we can't continue to rely on unpaid caregiving from family and friends, as more and more older and disabled adults are living alone. In fact, we should be supporting our unpaid family caregivers, who offer California over $63 billion in economic value and provide over 4 billion hours of unpaid care on an annual basis. California is enriched by its older and disabled adults, who bring with them a wealth of life experience and make valuable contributions that enhance the very fabric of our society. Unfortunately, the Golden State has historically fallen short on investing in these populations, resulting in a fragmented and underfunded system of care with services and supports that have not kept pace with the growing need. 2 out of 5 community living older adults experience adverse consequences due to unmet LTSS needs. So, as we look forward to the future and continue to double down on MPA implementation, we look forward to a California that is equitable, affordable, and high-quality long-term services and supports statewide. Services that are easy to navigate, services that are accessible in every community, services that are affordable and delivered by a high-quality, highly valued workforce. Californians deserve nothing less. The system must strengthen the individual, their family, caregivers, and the community at large. It must promote the individual's well-being, social participation, and economic independence, and it must prevent impoverishment and remove barriers to employment. On behalf of the California Collaborative for Long-Term Services and Supports, we look forward to the future, a California for all ages and abilities. Thank you.
Thank you, Maria, for that excellent presentation. I think you laid out wonderfully the challenge ahead of us to build systems for care that can provide for the long-term care needs, create more opportunities for people to get the care they need at home and in the community. So thank you so much for the presentation. Thank you for your leadership at the California Collaborative. I want to point out that the Collaborative is the premier sponsor for the 2023 Senior Rally Day. The Collaborative's strong involvement and partnership and sponsorship of this annual event is greatly appreciated. So thank you, Maria, and to everybody at the California Collaborative. We are just a little bit ahead of schedule, so we're going to take a little bit of a break. We're going to take a break between now and 11:10. And at 11:10, we're going to come back and we're going to have a panel on about equity in the master plan for aging. So give yourself a moment to take a rest here. and we will see you back in 10 minutes at 11:10. Thank you. Welcome back, everybody. The next section of our Rally Day is a panel discussion on two important themes of the Master Plan for Aging: inclusion and equity. At the conclusion of the panel discussion, you're going to have an opportunity to submit questions to the panelists. You can do that via the Q&A message box that's located directly below the video screen. Once you've entered your question, please click the blue send message box in order for your question to be forwarded to the person who's reviewing those questions and then posing them to the panel. I'm excited to introduce the moderator of the panel, Marina Augusto, who is the Equity Officer for the California Department of Aging. Marina is going to moderate the panel discussion, and she's going to introduce our three distinguished guest panelists. Welcome, Marina.
Thank you, Kevin, for the introduction, and good morning, everyone. Thank you for joining the panel on equity today. I would like to take a moment to acknowledge John Pointer, Chair of the Joint Rules Committee, and Janice Baylor, Executive Director of the California Senior Legislature, for elevating the importance of equity during this event today. I'm not only honored, but delighted to introduce you to my esteemed colleagues who work tirelessly on issues impacting older adults, but more specifically, older adults from diverse populations who encounter many barriers and disparities related to access and services. Joining me today is Rigo Saborio, Vice President of Equity and Community Impact at the SCAN Foundation. Rigo oversees the foundation's efforts around diversity, equity, and inclusion to ensure all older adults receive the services and supports they need to age well. He has over 30 years of experience in the field of aging, with an emphasis on public policy, diversity outreach, administration, and direct service. Next is Kathleen M. Sullivan, Executive Director of Open House in San Francisco. She is an accomplished speaker, author, and trainer on issues related to LGBTQ aging, gender equity, affordable housing, and social environments. As an appointed professor at Oregon Health Sciences and Portland State University School of Public Health, she lectured in gerontology and families and aging. Dr. Sullivan holds a PhD from the Nohad Tulane School of Urban Studies and Planning at Portland State University, where she co-authored Oregon's first study on transportation issues for older adults and the first study of housing for LGBTQ elders. Last but not least is Norel Wheeler, who holds a master's in public health and behavioral health sciences. She works for Family Caregiver Alliance of San Francisco, where she exemplifies her skills as a consultant, drawing from dedication to the field of public and behavioral health sciences. With 25 years of experience, Norel has a disciplined passion for social justice, which can be seen throughout her professional works and as an alumnus of the American Society on Aging Rise Fellowship. Passionate about bringing the surface underwater topics centered around equity and ageism, Norel has cross-cultural expertise on issues related to psychosocial and environmental risk factors, man-made disasters, neurological disorders related to brain health, and caregiving. To kick off this panel discussion, I'm excited to highlight Governor Newsom's executive order on equity, which directs state agencies and departments to take additional actions to embed equity analysis and considerations in their mission, policies, and practices. This action will help expand opportunity for all by addressing disparities for historically underserved and marginalized communities. This is a huge step in establishing cross-sectoral efforts and partnerships under the administration. In addition to this commitment to advancing equity at the highest level in state government, you already heard from Maria, California's Master Plan for Aging outlines 5 bold goals. And I would just like to remind you of those goals. Number 1 is housing for all ages and stages, health reimagined, inclusion and equity, not isolation, caregiving that works, And number 5, affording aging, and along with 23 strategies to build upon the work that's already been implemented within the last 2 years. Recently, the California Department of Aging released its 23-24 initiatives, building on the first 2 years of that work. Each initiative features a designated area of focus based on the following criteria. Number 1 is delivering results with an emphasis on reaching more people and improving quality of services and supports. Analyzing data is number 2, not only analyzing data, but policies, funding, and programming. And then number 3 is communicating. And this is all about sharing information and resources to the public with a renewed commitment to equity, language access, and disability access. So considering the level of expertise on the panel today over probably 60 plus years, I would really like to hear from our panelists at this time and learn how they are lifting equity strategies in their organizations, as many of you in the audience today are probably grappling with some of the same struggles or barriers and are at different stages. So hearing from their wisdom, their tips and tricks would be very helpful to not only me as I grow in my expertise, but to the rest of you. So without further ado, I'd like to turn to the panel at this time. And why don't we begin with Norel?
Yeah, so, right now, FCA, I've been there for about 4 years, but right now what we are working on is we're working on a couple of grants. There's an NIH grant that is, using innovative interventions to support caregivers and look at ways of dismantling some of the hot topics that I'm sure we've all heard about today as far as supporting caregivers. There's also what we're working on, a Cal Grows grant that's actually funded through the CDA. And it's a series of trainings geared towards professionals and paraprofessionals in helping dismantle some of the isms associated with equity. So that's what we're doing right now.
Thank you. Kathleen?
Hi, thanks, Marina. At Open House, where I work, we provide services and care as well as affordable housing to LGBTQ elders. I think when we look at how service providers, housing, and programming, particularly through, for instance, our AAAs, intersects with LGBTQ elders, what we are doing first and foremost is providing training. We have a rather robust training and transformation program that really helps people from the very basic sort of what we call LGBTQ 101. So just the basics of working with our diverse community, all the way up to clinical training and services. And we find that the training process of working competently and compassionately, as well as with humility, with LGBTQ older adults, and really understanding the intersectionality that each person brings to a service provider is what helps to create safe, accepting, and spaces where services are provided at a high level of care.
Thank you, Kathleen. You bring up some very important points, working in the field of equity and working with underserved and underrepresented populations is the importance of cultural humility, cultural responsiveness, intersectionality in the work that we do. And so thank you for elevating those. Rigo, you're on.
Well, Marina, thank you so much. It's a real pleasure to be here with all of you and to serve on this panel with my esteemed colleagues, with you, Marina, as well as Kathleen and Norel. And I also appreciate the California Collaborative for sponsoring this, and the California Senior Legislature as well, and my good friend Kevin, who is serving as the MC today. So good to see you as well, Kevin. Anyway, for the SCAN Foundation, that I work for as the Vice President of Programs, Equity, and Community Impact is an independent public charity in Southern California. It is devoting to igniting bold and equitable change in how older adults age in both home and community. Over the last year, we renewed our commitment to supporting aging well in community through a new strategic plan, infusing diversity, equity, and inclusion into our organizational DNA and all aspects of our work. And of note, prior to joining the SCAN Foundation, I was engaged as a stakeholder in the development of California's Master Plan for Aging. Early on in the state's MPA development, stakeholders like me raised the importance of equity being a central tenet of the Master Plan for Aging. But in any event, last year, the foundation engaged our staff in considering the ways that equity would show up in our work, both internally and externally. And this resulted in the development of a comprehensive DE&I plan that outlines specific objectives, actions, and outcomes across all program areas, our partnership, and our organization. This year, we're going to be working to implement this plan and build metrics to track our progress toward our stated goals. Alongside this process, we developed a new strategic plan that we are putting into action this year. Equity is baked into this plan, and it's embedded in all our strategic objectives to evolve models of care and financing so that health and aging support reflect the needs, to drive representation and data collection and analysis, and incentivize inclusive technology solutions, as well as to improve financial security for older adults by addressing root causes, and finally, to reduce health inequities and improve lives of all older adults. Equity is also a specific aim of the Advancing Health Equity and Aging initiative we launched last year. The initiative aims to reduce health inequities and improve the lives of older adults from historically marginalized communities, with an emphasis on older adults of color by convening, organizing, and harmonizing efforts through a diverse cross-sector network of leaders and accelerators. Together, we will develop and design solutions targeting the specific drivers of poor health outcomes, especially among historically marginalized communities and with an emphasis on communities of color. And simultaneously, we are dedicated to engaging those with lived experience at each phase of the work to consistently ensure a person-centered, equitable approach. And Marina, you asked about sort of, the tips, given what, how we are uplifting equity within the foundation. So, sort of there are takeaways. And so what's enabled us to accomplish these steps over the last year that I would offer as tips is that, we engaged the full team, including the executive leadership and the board. We built alignment around a shared vision. So clearly, this doesn't sit within a department, doesn't sit within an administrative HR department. This is infused throughout the entire work of our foundation. I'm not kidding when I said, we're making this part of our DNA. And we must have a shared vision. So, so it was important for us to also align around the why. And not just the why are we doing this as an organization, but also for the individuals. Why are we doing it as individuals? What's in it for you? What's in it for me? What's in it for all of us? And so we developed a shared definition of equity, and we realized that through that process, we all had a different way of defining equity. The organization and the team needed to agree on what we meant by equity, so we could align on what the policies are, what practices, programs, and populations we would actually prioritize and target, and how best to do so. Without an alignment, we'd all have different disparate ways of getting at it, and we really wouldn't make much progress. So, so for us, just of note, so when we talk about equity and aging, we mean fair and just opportunity to age well, regardless of age, race, ethnicity, ability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, and other factors that affect access to care and health outcomes. We also carried a process to assess where we stand with our efforts to center equity in our policies, programs, and practices. And through it, we identified our own strengths and the gaps. And through this process, we also developed our equity goals and objectives. And finally, as I previously mentioned, this year, we are making a wholehearted effort to launching efforts to establish metrics to measure progress towards these goals. And only in this way will we be able to tell how well our efforts are actually taking root and also holding ourselves accountable across the foundation to making sure that we are, walking the talk, so to speak. So those are some of the things that we've done, and to help us uplift equity and center equity within our work across the foundation, which I would offer people consider doing the same within their own organizations. Thank you.
Thank you, Rigo. You mentioned some very key principles. And being with CDA for about 4 or 5 months now, I'm learning the importance of what you reference as bold and equitable change, but also embedding it in the organizational DNA. I've been referring to it as weaving equity into the fabric of the organization and doing business differently. And absolutely, growing ambassadors within the department, having buy-in, really being able to create metrics and measuring, doing landscape analysis, and also, identifying gap areas, areas of quality improvement, but also coming to it from a space of having courageous conversations, of understanding where staff and leadership are very key to, just as you mentioned, centering equity efforts. But it's also about aligning efforts at the highest level through the California Health and Human Services Agency, through the governor's office, through our partners, through our community-based organizations, and not losing touch of the end user and the people that we serve. So thank you for all those key points. Very helpful. So soon we'll be moving into our question and answer period. So I'm going to just double check to see if there's any questions in the queue. If not, I do have another question for our panel at this time. So just checking on questions coming in. There is a question that I will impart to the group, to the panel, and then whoever feels compelled to answer, we can do that at this time. So in your equity work, are you also including equity and technical skills and training for seniors who need it? We'll start with that question, and then we have a few others in the queue.
I'm happy to start. From the foundation side, we're looking at it more from even further upstream. We're looking at how is data being collected that then feeds into the algorithms that technology uses to make decisions. And because our concern is when we think about equities, is that not all voices and perspectives are being represented, and the data that's going into these shaping the algorithms, particularly as we think about artificial intelligence and the work that's coming from that end. So from the foundation side of things, it's not so much on the end user side, but more upstream in terms of how is the different perspectives, different lived experiences, different demographics, and particularly from the marginalized communities and communities of color, are being considered and taking and being making sure that it's part of this whole formula.
I'll just thank you, Rigo. I'll just say from the provider standpoint, we, in terms of equity, have been working, particularly during the pandemic and the start of the pandemic, and realizing that, there were, the light was shown more brightly on disparities, particularly around healthcare, but then also about what we refer to, of course, as the digital divide. And so partnering with other nonprofits in San Francisco, as well as being the recipient of some gifts from our corporate sponsors, we continue to work with our community members, particularly the API and the BIPOC community members who have not had access traditionally to technology, and offer one-on-one counseling and training, as well as providing tablets for the most part if people don't have don't have a piece of technology themselves. And what this has done in particular for our API BIPOC and our disabled seniors is they're able to access program and services when they weren't able to do that in the past. And it's created more of an equitable playing field for people as they are interacting with, whether that be their healthcare provider, their mental health provider, or programs and services at Open House.
Yeah, and I'll just chime in. Thank you, Kathleen and Rigo. Similar to Kathleen at FCA, and of course during the pandemic, we that was one of the first things that we looked at was accessibility using technology to make things accessible for caregivers, but also for their care recipients. And so the way that FCA implemented that was working with the various counties. Counties were able to offer, free technologies, iPads, laptops, if caregivers would like them. And that was the platform that was used to make sure that through an equitable lens, that caregivers were able to continue in their role as caregivers with telehealth appointments and just making things easier. So, yeah.
Marina, can I add something to?
Absolutely.
Just from a perspective of my previous life of heading up a community-based organization before coming to the foundation, I think it's what's incredibly important also, and I think my colleagues Norel and Kathleen will agree. I think it's critically important not to obviously to offer devices and technology to make them accessible to all older adults, but I also find that if you offer technology in the form of tablets or other forms, but they're not able or know how to use it, it's like having an amazing collection of books, but sitting there and collecting dust because you don't know how to read. It's equivalent of that. So I think what's critically also important as we think, consider, solutions to access technology, that the other side of that same coin is also making sure that there's literacy engaged in that, and that there is a support mechanism as well for older adults to be able to access or to have questions, answered. On a personal level, I remember, my mother she was alive, and she, was new to technology, and she would have a hard time going to sleep until like 1 a.m, and she was there trying to figure out a system on the phone, but she was adamant and resilient and really finding ways, and she would call services to get support. So not only learning, but also to get support, but then having the right, approach when you get somebody on the other end to help you as well, to understand, if you're a person that's hard of hearing, if you're a person with dexterity issues, if you're a person with language, limitations, that you take all that into account also. And if you're a person who's older and new to technology, there's also a certain way of working with individuals. So it's a comprehensive approach is what I'm reminding folks of.
And if I can tag onto that real quick, Rigo, also just the dismantling the myths around using technology. We've found that, across the age spectrum, people have fears about using technology. So I think that has to be another component to be explored as far as supporting the BIPOC and other communities. It's just dismantling the myths around the use and learning how to use technology too.
Thank you all for sharing that. And, and Rigo, the comprehensive approach is very key because we're also talking about affordability, bandwidth, accessibility, and the myth. You're absolutely right, Norel. I still struggle with IT, and my team, I tell them I'm the least IT proficient person, but absolutely, being able to think innovatively as well. Maybe partnering with our younger generation folks who we give a telephone to, and they're able to navigate it so promptly. But very well said, and points well taken. Thank you. Move on to our next question at this time. So one is just thanking you, Rigo, for your great work and wanting to know where they can find your written statement for your definition, I'm assuming on equity. So I don't know if you can put that in the chat or share at a later time.
Yeah, I'll happy to share at a later time, and I'll put that in there. Yes.
Great, thank you. This next question, what will ageism look like in California in the next 5 years? Will we see improvement or more of the same discrimination?
Good question. Ooh, that's a good question. I'm going to say it's going to depend on a couple of factors. And we, Rigo, I've kind of talked to you about this before. We've worked together. It's really about community, society, individuals understanding really what ageism and all the other isms like, or what they mean to you. And also key to this is understanding equity. How do you define equity? Do you really understand equity? Some people think equity is the same thing as equality, but it's not. So I think that no one really knows. I would say that we really don't know what it's going to look like in 4 or 5 years, but I will say that we are headed in the right direction, through the MPA, through DEI work that's, taking place not only in California, which I think we've done an awesome job at spearheading the movement, but when we think about it even nationally, there's a lot more to do and be done, but the key component I think that's going to be significant to where we do land in 5 years is going to be how we interpret and see and understand and learn about what equity means to us, and ageism means to us at the individual level, at the humane level. I think we have to start there.
Thank you.
I think one thing that I would add, thank you, Norel, is, I think there are things that we can do as organizations. And one thing that we have focused on really since we were founded 25 years ago at Open House is to create intergenerational connections. And we do that through a variety of different intergenerational programs, whether that's through our Friendly Visitor program or we have an arts program that matches to college students and a senior, and they work on a 6-month project. And I think we can't, it's hard to solve a problem. Ageism, that's a very large issue. And I think it can be very overwhelming for people. But if we look for opportunities of connecting generations, and I think that in some ways, the pandemic perhaps has given us a new tool where older adults and young people can communicate with one another in a digital space, but also that younger people are starting to understand the importance of being with others, so physically with others. And the Surgeon General just released a report this morning about isolation and loneliness, and that young people have higher rates of isolation and loneliness. And what we have found, and there has been some research, is that when younger people are connected with older adults, they have a better sense of calm, a better sense of purpose, and feel more socially connected. And, we're social creatures. So I think ageism needs to be dismantled at an individual level, but providing perhaps tools or opportunities for people to take advantage of, like intergenerational programming, I think is one way that we can help to reduce the amount of ageism that we experience in our society.
Yeah, I know. I would just add by saying that I think we also have to constantly be aware of the fatigue around the work, by some in terms of equity and the isms. And I think we must be resilient. We must continue. This is not a one-off. And I also, to Kathleen's point, you think about it from an intergenerational standpoint, where there are opportunities to expand our tent, if you will. So we're not just talking to ourselves, and really, we become an echo chamber. I think we got to get outside of ourselves in terms of a network of aging and disability. We also have to engage others who have a common theme of wanting to achieve equity, be it health equity, financial equity, whatever that equity is, that we bring others into the fold and either by generations or professionals or other advocates in a different arena like the racial equity or social justice movements, but bringing us together to have to forge a much stronger united voice towards a common theme. I think that's going to be really helpful, because I think often we think of having these conversations, and oftentimes it's among the with all due respect the usual suspects, and we have to get outside of ourselves to achieve that. So I echo Kathleen in thinking about the intergenerational approach.
I also want to add mention one other thing here as well, is that I think there's a lot to be learned from regarding aging and disability from other racial and ethnic communities and LGBTQ communities. The way in which we look at aging and esteem our elders in different cultural practices, collectively caring for them within our community, within our families, really honoring their presence, and working with our community-based organizations that have that lens, borrowing some of their experience and knowledge on removing some of the stigma regarding aging and disability, I think is also something that we can really learn a lot from. The other thing is the impact of institutional and systemic discrimination that happens through many of our policies. And so that also, I think, is an area that we need to really look at, how we're perpetuating inequities and disparities of marginalized communities. So I'm going to move us to our next question now. And this question is, people talk about equity as a buzzword with no meaning or action in regards to equity within our Latino and low-income communities. So I don't know if that's more of a comment or a question, but would anyone like to respond?
Well, I'll just say, at open house, and I agree that sometimes people talk about this but don't actually take action. So I really appreciate, Rico, you going through it. The SCAN Foundation did in the last year, and now implementing it. And we're about a year behind you at open house. We are looking to make an investment of time and money at open house to bring voices in, community members that we serve, as well as our wonderful staff and our board, and develop our what we call a JEDI plan. So we have a committee that's been working on this for the almost past year on justice, equity, diversity, and inclusion, and what that looks like, and then investing in having someone who can help us on staff to actually implement that plan and continue with the training of staff, but also really getting feedback and co-creating the program and services that we provide with our community members. I think that sometimes, local or smaller organizations with all good intention are creating programs for community as opposed to with community. And so I agree. I'm not sure who wrote that or who made that comment, but I think that the SCAN Foundation certainly is a great model of how we need to make true investment, and JEDI or DEI needs to be as ubiquitous in our conversations as budget is. We talk about money all the time, but why aren't we talking about JEDI all the time?
Yeah, in reality, and I appreciate Kathleen, sharing those words, because she is the executive director. It starts from the top, and that's where it really happens. I give credit where credit is due with the foundation. We have our new CEO, Sarita Mohanty, Dr. Mohanty, came in with a vision with the E&I, wanted to expand on that, really wanted to bring some action to that. That's why I'm here, to help sort of, really bring that to life. And it really starts with leadership. It really starts with that buy-in. DE&I not that it won't work, but it's a struggle to get it going if it sits within a smaller department and not really where you have the ability to infuse it and work it across your respective organization. So it really does start with that leadership. And I think there's a reality that you can't move everyone. And so, not everyone's going to be moved by this. Not everyone's going to, I see the need or the reason for the action. But, so sometimes you do have to make decisions, and sometimes you got to move and pivot from there and really focus on those you can move and bring along with you. And also, I think, action doesn't necessarily only start within. I think it can be empowered by those around, by the community themselves, and really asking for that. Community does change around us. Sometimes we age within ourselves and within organizations, and the changes demographically or otherwise, happen. And if you don't pay attention to it, you will certainly become irrelevant. So there's a real business need and a business case that also exists. So it's not just a humanitarian and a human issue, but it's also a business issue.
Thank you, Rigo. All right. There were some follow-up comments or questions regarding digital divide. So I wanted to just mention those. So it says, do you address the tech divide for the rural areas of California where Wi-Fi is not available and cell service is spotty? Then another, piggybacking on that, as a senior, I want to embrace more technology, but I'm fearful of financial scams. How can I not become a victim?
Well, I mean, I'll start again, kind of putting my hat on as a former CEO of a community-based organization, and just kind of, again, thinking practically here. So if you are a senior, depending on where you live, identify a resource, perhaps where you can access courses being taught. There are a number of senior centers and other community centers that are offering literacy programs, and which often do include, particularly for older adults, the issue of of avoiding fraud. And so I would start there, sort of just from a practical standpoint. Now, in terms of Wi-Fi and availability, I can't speak much. I can say that that's where advocacy really comes in, and that's where a lot of the advocacy and education, and I think where public and private partnership can really be a boon. I think we got to look at the telecommunications companies. They have a significant role to play, and I think where government and these entities can really work together, and I know there's some cases that they are. I think we got to make sure that they come to all corners of our state.
Thank you. There was also, I think, a follow-up. This question is about dismantling ageism and ableism will require a movement. Any tips for movement building? Can we learn from disability partners?
I guess I can try to answer this question. I think, as a principal, when we're trying to understand, equity and, dismantle the isms that surround equity, I would like to say that, equity it's not up for debate at the organizational level. And I think that this should be, understood by, people that are the powerhouses, the decision makers or stakeholders or strategic planners, for example. You mentioned it earlier, Marina, and I would piggyback that it is an interwoven part of humanity that has purpose, and we sometimes forget that that's what equity is about. I think that perhaps what's happened is for so long, equity has been a topic that's just remained underwater, and so through the event of our pandemic, it no longer can remain there. So as a few tips, I think one would be to, at the individual level, we take the time to understand again, like what equity actually means to each and every one of us. If we're trying to dismantle it at the, let's say, at the structural level within like organizations or systems that are providing services to our communities and to the public, then again, it would be at the individual level, learning what equity means to you and then dismantling it. Along those lines, another tip would be to then, within the structure of organizations, would be to allow for growth and development, and allow for the growth and development part of understanding what equity, then means through the backdoor lens of a community and, or culture for the populace that's being served. I think it's here where there will be opportunities to basically dismantle the isms that surround equity, that were mentioned earlier, like ageism, ableism, racism, etc., for example. And I think it's important too to really allow for time to explore the various, cultures, cultural needs, and those influences on the quality of life as it pertains to one's overall, well-being, and even looking, like we mentioned earlier, intergenerationally. Again, it's just all interwoven into life. And I think that you need to give a lot of time for this to occur, because I think that things will come up from members of an organization or a system, within the design of like professionalism, right? Training, webinars, etc. But I think it's not until a person that works for an organization goes home and is dismantling their own isms around equity that you then have growth, right? And that you really have the opportunity to embed what you've learned, and I think that's where you're going to have your most significant impact, is when you learn about equity and implement it into your personal life. So I think finally just understanding, that understanding and working towards another component and final component of equity within an organization, which I think is the implementation part, right? We kind of commented on that earlier, but equitable implementation, that's going to occur when, there's strong equity components, including, paying explicit attention to the culture, the history, the values, the assets and needs of a community. And then those are then integrated into the principles, the strategies, the frameworks, those tools that are created by an organization or a system. So I know I kind of went a roundabout way of answering the question, but I hope that makes sense, because the end goal is for this to all be sustainable. It's not something that we want to just bring up and say, as at an organizational level or individual level, check that off the box. We want this to be sustainable for generations to come and beyond, because like I said, it's interwoven into the fabric of humanity.
Thank you, Nora. I like what you said about, what I call legacy building and sustainability. That equity, remains, whether leaders come and go, that it's at the core and the center of how we do business and our guiding principles. So thank you for mentioning sustainability. I'd also like to note just on this, further expand on this, is that I think being at the state level, what needs to remain at the core of the work we do is hearing community voice, be it by way of advisory bodies or by ad hoc committees, or going on the road, going to communities, in communities, listening sessions, not involving communities after the fact or as an add-on, but from the get-go, from program design, implementation through evaluation, that we have a community-based participatory approach to how we do business, and getting that feedback as we go along. I know sometimes being part of state government, we have our timelines, we have money that needs to get out, we need to have that RFP or that RFA out. And, you know, oftentimes in that process, we lose sight of the important nuggets that need to happen to create that sustainability, to create that equity framework, and to really be intentional in the work that we are doing as leaders and as good stewards. So with that, I think we have time for one more question as we're nearing the noon hour. And this is, can each panelist describe briefly how they would define successes in terms of building an equitable California? That's a big one.
Wow.
Mean that we're the most diverse state in the nation.
Can you repeat the question again? Because I'm
sure. Can each panelist describe briefly how they would define successes in terms of building an equitable California?
I'm gonna say I'll go first because it's short and sweet. I think when at the, like I said, you know, at the organizational and the systems level, when everyone has had the opportunity to really, through trainings, however an organization or system, a company, you know, designs it through trainings that actually touch on the humanity side of it. I think because we've lost touch with humanity through, I mean, I'm grateful for technology and all its uses and the advancements, but we have lost touch with each other. And so I think by dismantling equity and the isms that surround equity or equality and or diversity, when you've been able to, let's say, get training and you can go home and or be around the closest friends and family members, and you can implement what you've learned in the training into your everyday life. And, you know, the person at the grocery store, you would normally kind of, you know, have an adverse, let's say, reaction, or I'm giving this as an example, experience with. Your mind now has you thinking, and you see them and you see yourself in relations to them through a different lens. And then you can go back to work, and someone at work can notice that subtle or that positive change in you, or you can talk about it. Then you know that we've hit a milestone in a positive way. And so I'll leave it there and just say, you know, that's when we'll know.
I would say, well, thank you for the question. This is we could talk for multiple days about it. I think that when individual Californians feel the systems that they are interacting with are responsive to their needs and are accessible to them, whether that be based on language, on culture, that we have systems of care, services, programs that are accessible to people so that they can thrive as they self-determine and live a life that each individual elder in our state defines as successful, however they view success. And I think until we have this ability across the state for systemic change that is truly embracing of each individual person so that they can really see themselves reflected and access those programs, services, and the social environment, you know, we'll still have work to do. I'm going to leave it to Rigo, who's going to say something brilliant, I'm sure.
Yeah.
No, I was just I couldn't have said it better myself in terms of the comments that you, Kathleen, and Norel have made. So I'll just add to piggyback on both of you, and I'll just say that this is a journey. Don't expect that we have that question answered 5 years from now. We're lucky we have it answered 50 years from now. But the point is that we're on a journey that we all have to really work together to achieve that end. And to me, what success will look like is when these fair, you have a fair and just systems in place that are offering the same opportunity to all to reach optimal health, financial success, and true happiness. I think that's going to be the key.
And I'll throw in my 2 cents as we conclude. And I go back to, so my background is in mental health, and I go back to a mantra that the mental health field uses all the time, and I think it's probably across fields. And this is really the mantra: nothing about us without us. And that is very true. And to me, the heart of the work that we do is based on our communities and the people that we are serving. And this is hard work, but I also call it heart work, because most of the people working in this field come to this field with a place of compassion and passion and a willingness to want to make change, being ambassadors and advocates and family members and caregivers, and really wanting to make a difference. And so to me, success, especially at the state government level, is true governance that's representative of the people that we serve. So seeing people at decision-making tables that really can speak to community need, and also fiscal resources that come along with this. So it's not only, saying the right things, but it's doing the right thing and being backed up financially through policy and dollars and funding. And then also, I think the last thing for me is going off of what Rigo was talking about, is like not losing hope that this is a work in progress. And even though it may be gradual or incremental change, but change has happened and will continue to happen. And we just have to trailblaze that and partner and do the best we can. So thank you so much for your time today. I want to thank each panelist and also you, audience, for committing your time to joining us today. Thank you.
Thank you.
Thank you, Marina, Norel, Kathleen, and Rigo, for the excellent discussion. I always learn so much from hearing from all of you. Thanks for sharing your experience and your expertise with all of us. I was excited by a lot of what I heard today, and I want to take a few moments just to elevate a few things in particular. The first is equity and inclusion. So today's theme was inclusion. We heard lots of speakers, the legislators, the Department of Aging leaders, advocates, the experts on the last panel talk about how important it is that we include everyone in our collective advocacy, and that collective advocacy is focused on advancing equity for all of us as we age. Aging is an equity issue. For generations, systemic inequities in racism and healthcare, housing, and access to wealth and resources have kept people of color, women, LGBTQ, older adults, those living with disabilities, immigrants, those with limited English proficiency from accessing the full array of opportunities and supports that have been provided to other groups. And when people from these communities age, these challenges become even greater due to the compounding effects of the inequities they face throughout their lives and the new unique impacts of ageism. So as the state prioritizes equity, aging must be included as an important element of that work. And as we continue to work together to implement the master plan for aging, we must continue to center equity to ensure that the systems we change, that the system changes we pursue, that those changes impact those communities with the greatest need. So that was one theme that I heard today, equity and inclusion. Another theme I heard was engagement. We heard the legislators and the leaders from the California Department of Aging talk about how important our collective engagement and advocacy has been in the process of passing legislation implementing programs, and building the future of aging that we all envision and that we all need. That engagement is what led to the Master Plan for Aging. It's what led to numerous policy changes the last couple of years. It's what's led to a wide variety of legislative proposals that are being introduced this year. You heard about proposals related to access to healthcare, improved services for people with Alzheimer's, consumer protections for people in nursing facilities, workforce development, and more. These proposals only get proposed and only become real because of our collective engagement with policymakers and our advocacy on behalf of the communities that we come from. So keep it up. In addition to those themes I heard today, I also want to take a moment just to highlight 3 opportunities that we see at Justice and Aging for our collective advocacy going forward. The first opportunity is that we need to preserve the gains of the last few years. So over the last couple of years, we've seen new investments in aging that have expanded access to healthcare, expanded access to home and community-based services, increased access to nutrition services, and even housing. Later this month, the governor is going to propose his revision of a proposed budget. And in the months ahead, the governor and the legislature are going to be working together to finalize a budget for the next fiscal year. We all expect that the revenues in that budget are going to be lower than the last several years, and that there's going to be a deficit between the revenues for this year and the proposed spending from years prior. We have to work together to ensure that even as revenues are dropping, we protect recent gains for older adults and their communities. We need to push back on any proposals that would cut services and programs that older adults and people with disabilities rely on. So that's our first task for the year ahead. The next opportunity that we see at Justice and Aging is to build in California a home care system that works for everyone. The majority of older adults and people with disabilities want to live at home even as their care needs change. But right now, California lacks an affordable, inclusive, and equitable system to support everyone. Maria laid this out beautifully in her presentation. Right now, too many Californians cannot afford in-home care, and many people, especially those with complex needs and people of color, are instead forced to receive that care in institutional settings like nursing facilities, instead of at home where they want to be. At-home care and support like help with bathing, dressing, cooking, care coordination, these are all key to ensuring people with different healthcare needs can remain living at home and connected to communities as they age. Today, much of this support is provided by family caregivers who bear a big financial and emotional burden and risk to their own financial security as they provide that care. Now, we can change that. With adequate funding, California can build a system of care that everyone can afford, that's easy to navigate, and where everyone can access the services they need at the right time and in the setting of their choice. Robust investments in at-home care would support family caregivers who are far too often filling in the gaps of a system that isn't robust enough. We could also better support California's direct care workforce so that care jobs are valued and adequately compensated in order to provide care for those that we love. California needs to continue to invest in and build the Medi-Cal Home and Community-Based Services Program. And the next big step for our state, a place where we could lead the nation, is to develop additional models for financing and providing universal access to long-term services and supports for those who are struggling so much to afford that care today. And the final opportunity we see at Justice and Aging for the year or two ahead is to end elder homelessness in California. Now, unfortunately, older adults are the fastest growing part of the homeless population in most parts of the state. In some counties, older adults now make up half of the homeless population, and a significant number of older adults who are homeless today are experiencing homelessness for the first time after age 50. Lots of money has been dedicated to addressing homelessness in our communities over the last several years. However, none of this money has been specifically targeted to older adults and the unique issue of older adult homelessness. So we need dedicated attention, dedicated strategies, dedicated funding for older adults who are experiencing homelessness. One specific type of support that we're working on at Justice and Aging with in partnership with many other organizations and with the legislature is we're calling for the creation of a new targeted rental subsidy program that would provide very low-income older adults and people with disabilities with the support they need to attain and maintain housing so that we prevent homelessness from happening in the first place. The number of homeless older adults in California is a tragedy, and it's a preventable tragedy. We can fix this problem. We must fix this problem, and we can do it if we work together. All of these opportunities, all of the issues that we heard about today can only get better. We can only make progress if we all work together through collective partnership and collective engagement. If we do work together and we do all stay engaged and we stay active with our policymakers, we can continue to elevate aging in the state and we can build systems that we all need as we age. On behalf of the California Senior Legislature, I want to thank you all for being here. I would really like to thank today's presenters. It was a very informative program. And I also want to thank John and Janice and Maria for all of their work behind the scenes putting today's event together. This concludes the presentation of the program. We're now going to take a lunch break. During the lunch break, you can take the opportunity to revisit the lobby to view legislator messages as well as the exhibitors. Again, I want to thank our sponsors and exhibitors that made this event possible. And then after the lunch break, there will be an advocacy program. That program will run from 1 o'clock till 3:30. This portion of the program brings legislators or their representatives together with Senior Rally Day participants. And during this time, each presenter in the program will speak about their bill or a budget request. There's 10 presenters, and each presenter has 15 minutes to present. The advocacy program schedule can be found in the materials tab on the toolbar of the Senior Rally Day lobby room. This document identifies the legislation and budget issues that are going to be covered during the program. So what we recommend is that at 12:45, you navigate to the advocacy meeting tab on the toolbar. So 12:45, advocacy meeting tab on the toolbar on the main lobby page. Click the link in the center of the page and it will take you to the advocacy program, which will start at 1 o'clock. So again, navigate to the advocacy meeting tab on the toolbar. You'll find that on the main lobby page. Once you're on that tab, click the link at the center of the page and it will take you to the advocacy program, which will start at 1 o'clock. But we recommend you get on there at 12:45 just to be all set up and ready. So thanks again for being with us and see you at 12:45 for the advocacy program.